Okay, so our next task is bilateral itchy eyes. Bilateral itchy eyes. In this particular case, you're an FY2 in a GP practice. So if the 30-year-old lady has presented with the itchy eyes. So itchiness is in both eyes. One more time. She also experiences a yellowish discharge from both eyes. She experiences sticky eyes in the morning, that is matting of the eyelids. The problem started 2 days ago. Overall, she has got a problem with running nose. She gets running nose very frequently. She reacts to pollen, and she is on antihistamine. Okay, so she has got allergic rhinitis, and she's on antihistamine. Other than that, she is fit and well. Problem started 2 days ago. Yeah, in the morning, gets sticky eyes. She has got lowish discharge, suffers from running nose frequently, and she reacts to pollen and takes antihistamine. Approach to the task. We're going to take the history of the itchy eyes or itching eyes. When did this start? Is it in both eyes or one eye? Clarify. Is it getting worse? Is there anything that makes it better, this itchiness? Is there anything that makes the itchiness worse? What do you do to relieve the symptoms of itchiness? And whatever they do, does that help? They need to think of the differential diagnosis. Is it bacterial conjunctivitis or viral conjunctivitis? Discharge. She has got yellowish discharge. Recent flu or coryza symptoms? No. Redness of the eyes. She has redness of the eyes. Okay. Acute closed angle glaucoma, we discussed already. The eye pain, the reduced vision, the nausea, vomiting, the redness. Keratitis, eye pain, blurring of vision, risk factors including use of contact lenses or recent flu-like illness, which may suggest of herpes simplex keratitis, or swimming or sleeping with contact lenses for bacterial keratitis. Anterior uveitis, there will be eye pain, usually unilateral, and there will be presence of systemic diseases like an ankylosing spondylitis, IBD, SLE, rheumatoid arthritis, Behçet's disease. This is just a few, okay? So just correcting up this one. Yes, okay, good. So that is what the differential diagnosis. Foreign body, yeah, get the foreign body sensation, viral or bacterial conjunctivitis, keratitis, they're all going to give you that, yeah? And of course, one of the differential diagnoses in here that we cannot forget is what? Is allergic, it's right in here, is allergic uveitis, yeah? So allergic conjunctivitis, yeah? Of course, allergic conjunctivitis, the presence of a running nose in this particular patient. Yeah, running nose in this particular patient or other allergies in the patient may suggest more of allergic conjunctivitis, and would expect allergic conjunctivitis to be what? Bilateral and not unilateral. Yeah, so let me do that. Let's remove in here. Okay, good. So it's going to be bilateral. Just 1 second. They're up there for us. Over here. I've lost the screen, unfortunately. Okay, so let's get back the screen for us. Okay, here we go. Go back to the screen, which is excellent. So we're talking about this one, the allergic uveitis, allergic conjunctivitis. It will be redness, of course. What else? It could be discharge. Okay, it will be a discharge. The eyes will be itching. That may suggesting more of what? Of allergy. And the history of other allergies. History of other allergies. Okay, like what? Like, of course, maybe hay fever, yeah, or allergic rhinitis, which this particular patient has. Allergic rhinitis, which this particular patient has. Okay, good. So next we go to examination. We complete the rest of the history. Remember, after differential diagnosis, we complete the history. What the histories? The P. maftosa, the eyes, the effects of symptoms, and summarizing. And then after that, we go to examinations. We need a visual acuity, we need inspection, we need a fundoscopy. You may not have a fluorescence examination if you're in GP surgery, but of course, if you're in ophthalmology, you may have a fluorescence examination of the eyes. And then afterward, when you mention examination, this is the examination that we may see. As you can see in here, it's a bilateral redness on both eyes. They look a little bit swollen up. Why they look swollen up? Because this is an allergy. There will be some kind of swelling one way or another. Then you explain the diagnosis. It's an allergic conjunctivitis. Why it is bilateral? There is a history of running nose and using antihistamine, okay? And there is matting of the eyelids in the morning, some discharge that could occur. There is itchiness in the eyes that also pushing towards the allergy. Okay, good. So management, we're gonna advise to avoid pollen. This particular patient reacts to pollen. So avoid the allergens, e.g. avoiding pets or animals or pollen what they're reacting to. Advise to wash the hair before going to bed because any pollen trapped in the hair that can cause allergy. Ask if she has recently been walking maybe in the bush or walking in the open space. That is why you can get in contact with the pollen. Avoid rubbing the eyes because that again may introduce allergies. Apply cold compresses to the eyes. Apply cold compressions to the eyes. Use artificial tears that may help as well. Using of artificial tears. Okay, we have to. This particular patient already uses antihistamine frequently for running nose, which is an allergic rhinitis. So as part of this treatment, we need to prescribe antihistamine to use. Offer a leaflet about, of course, allergic conjunctivitis, and arrange a follow-up in 1 week time to see how the patient is responding, or we might need to adjust the treatment. So offer written information, follow up in 1 week time, give antihistamine, and give advice. Avoid, of course, contact with anything that triggers it. Wash hair before going to bed. Avoid rubbing the eyes. Apply cold compressions to the eye, and use of artificial tears. Thank you.